at its core, ultrasound is energy. And, there's prophetic people that have come way before me and many that will come after that described, including Einstein and Tesla, that the future of medicine will be described in frequencies and harmonics.
Welcome to the podcast, everyone. This is a really special podcast. Most of you know that I've been obsessed with revolutionary technologies to transform people's health. And as many of you have picked up our book, Life Force, which we spent 3 years going after, interviewing more than 150 of the top doctors in the world. And the ones I want to talk to you about today, I'm bringing you two brilliant medical doctors, revolutionaries in the area that affects everything you can imagine, from tremor to Parkinson's to potentially things related to brain cancer. The essence of it is we're going to show you incisionless brain surgery and the impact it can have. I know that sounds crazy, but it's really the use of something called focused ultrasound. And I've had the chance, when we're doing the homework on this, I literally was towards the end of my book, and I literally wrote an entire chapter, revamped the book to make sure we got this into it. So there'll be more details for you there, but I wanted to get the latest update from the men that are most powerfully involved. So first, we have Dr. J.J. Desai, who is the Chief Strategist and the Innovation Officer for Insight Tech, which has created the technology that's revolutionizing this around the world. And Dr. Ali Rezai, the Director of the West Virginia University Rockefeller Neuroscience Institute. He's the Associate Dean for John D. Rockefeller IV and Professor in Neuroscience. I've had a chance to spend time with both of these men, and I have friendship with them now because I've seen just the magical work they've done. So first of all, I just want to thank you both for joining us.
Pleasure to be here.
Thank you. Great to be here, Tony.
So let's get into it. I've seen some magic. I came and saw, Dr. Rezai, the work that you guys are doing. JJ was there, and we went over and it looked like I was entering into something you'd see at NASA. There was a man there that was, how old was he? Do you recall, Dr. Rezai?
Oh, yes. He was in his 60s.
Yeah, I thought he was in his late 60s. He shook so badly that he couldn't hold a glass of water. I tried to hand him a glass of water. His hand literally was like this. And then you guys put him into the ultrasound and measured what was going on in his brain. And there were so many doctors there, like I said, looked like NASA. And then you did your tests. And about 20 or 30 minutes later, the whole process was really about 5 minutes once you knew the target. And I was the first one who got to go in and hand him the water. And he literally reached out, grabbed the water, drank it like this. His daughter and his wife were there. They started crying. He drank the water and held it back. I went to take it back. He wouldn't give it back to me. He goes, no, I want to hang on to this. It was just so beautiful, so emotional. I know this is the result of decades of work. So why don't we start with you, JJ? Tell us a little bit, how does focused ultrasound really work?
Yeah, thanks, Tony. And I just would like to take a second. You're so passionate and dedicated to describing and discussing technologies that are changing humanity. And it takes a total community of people just constantly doing this to bring these to patients and their caregivers, which is the common denominator for all of us on this call. So thank you so much to you and your team. It's really a privilege to be able to share this with you and the community that's built this technology. But at its core, our body is effectively made of frequencies and harmonics. And so ultrasound is a form of energy. It's non-ionizing, so it's non-toxic, it's non-radiating. And the basic premise is we use ultrasound in daily applications. An expecting mother looking through her belly using ultrasound for imaging. Ultrasound carries energy in wavelengths, just like light. And the easiest way for me to kind of convey this is when you were a little kid and you took a magnifying glass and you harnessed the sun's power and energy down to one focal point on a leaf to create sort of this thermal burning effect. Brilliant scientists at Insight Tech and in combination with academia and industry have basically allowed us to take sound waves, which travel in frequencies, to get through the skull, refocus them, and bring them to a point where the conduction of that energy is additive, and we can actually create a thermal effect, a heating effect to change the dynamic of how the brain is working or not working in the case of some of the movement disorders we treat.
And what's the kind of impact that you're seeing then by using this new technology on the brain? Tell us a little bit of what the impact has been.
The first time I saw this, I didn't even know focused ultrasound. I've been a physician. I've been practicing and creating technologies for the better part of a decade and a half. And I walked into a room at an institution where I was on faculty and saw this take place, and it blew me away to the point where I knew I had to be a part of this. And what happens is that in the brain, we've been trying to look at some of the movement disorders that we treat for decades. And what we've done is try to get at them with radiation which is, can be impactful, but is really difficult to control and is kind of toxic on the way in and the way out. And what we've been able to do is effectively get to those points in the brain by using energy that's non-invasive in the sense that you don't have to cut anything or open anything. The energy doesn't hurt. You can't smell it. You can't feel it. But when it gets down to a focal point, you can control what's happening at the tissue level. And in the instances that Dr. Rezai will talk about, we're actually changing the tissue to stop what is happening as an aberrant or a dysfunctional effect, or we're helping the tissue reset in some instances to recreate a pattern that might be out of control, like an addictive type of pattern.
Right. I'm excited about talking about that as well. But for those that are looking at tremors or Parkinson's, describe to us what the procedure is like. Because when you say incisionless brain surgery, people can't imagine not cutting the head open to try to do something with the brain. It's almost like magic, like you're describing, like Star Trek. So what is the procedure actually like for the patient? Walk us through the steps, if you would.
Yeah, so the procedure is outpatient, meaning that you come and go in the same setting. There's no admission to the hospital. And effectively kind of feels and looks like you're getting an MRI. A patient will come in, they'll speak with their treating physician and staff and get prepared for the procedure itself. In the setting of movement disorders, they will actually physically lie down in an MRI. For the precision required, we do shave the head, and that allows us to conduct the energy in a very precise manner. As the patient's lying down inside of an MRI scanner, we're doing two things. We're looking at the specific areas in the brain that we want to treat, and we know exactly what those are. And we're delivering the energy. And the patient's awake and talking and an active component. And that's one of the most magical parts of this procedure.
And Dr. Asai, the one that I attended with you, the gentleman, like you said, was in the 60s. I believe he was a mechanic, so he couldn't do his profession any longer. It was emotional for him, to say the least. Did he need follow-up, or in terms of was he able to walk out that day and start to live his life again?
Oh, yes, indeed. I mean, patients go home within a couple of hours of procedure and they're done. And you're talking about people who've had decades of this tremor progressively taking over their lives, where they can't even do the basic things like brush their teeth, have difficulty with that, or taking a cup of coffee and drinking it without spilling. So, or we've had procedures on mechanics, airline pilots, or physicians or surgeons who need to use their hands for very precise movements. And it is life-changing. And I've been doing this procedure in the brain with brain implants for 25 years. But this new procedure of ultrasound has really revolutionized the way we treat tremor. So we don't need to do brain surgery anymore like we've done for 25 years in many ways. And patients just come in in an outpatient setting, get the MRI and get the ultrasound, and then we see it on the table, the tremor stops, and then they get off the MRI table and go home. So it has dramatically changed the way we treat patients, and it's key. There's no surgery. So it's an outpatient procedure.
It literally is like magic, and the level of joy and tears and emotion, you don't have to be related to the people to have that kind of emotion for them. Just see the astonished look on their face when they have control over their own body for the first time in decades. It's pretty amazing. Now, Parkinson's, there's 1 million people, I think, if I read correctly, that are diagnosed of living with Parkinson's, about 60,000 more per year. And I'm just curious, so essential tremor versus Parkinson's, you're able to treat Parkinson's as well? What might the differences be in this area?
So the tremor, essential tremor is mainly a tremor, a shaking, and it runs in families often. And so it's a different condition of Parkinson's. Parkinson's involves not only the shaking of the arms or the legs, but also stiffness, slowness of movement. So in this case, the ultrasound treats very well the tremors for the essential tremor and also deals with the symptoms of Parkinson's, the side effects from the Parkinson's called dyskinesias or the rigidity or stiffness. So the results are very good for tremor and for Parkinson's.
Wow. And the essential tremor is about 10 million people, from what I understand. I know President Clinton is a friend of mine. There are people like Katharine Hepburn had it, Sandra O'Connor. It's something a lot of people have experienced, and they think there's no treatment. So I've been reaching out to people since I met you guys and said, you got to go check this out. It's pretty extraordinary. Tell me, in the past, I know there's only one drug. I think it was approved in the 1970s for this, not very effective. Maybe you can address that. I remember you have the deep brain stimulation, I think was approved in the late 90s, if I remember correctly. And that's pretty invasive. Tell me a little bit about those alternatives and why this is so superior. I think it's obvious, but I think we should address it. Some patients have heard about the drug, or they've heard about deep brain stimulation.
Indeed. I mean, for a tremor, since 1996, the brain implants, which are just called deep brain stimulation, you make an incision on the scalp and then drill a small hole, and you place a pacemaker in the part of the brain causing the tremor, and you shut it down. So it's surgery, it's invasive, and we've been doing it for 25, 26 years. Usually, and there's a lot of medications, beta blockers, which lower the heart rate, other medications, primidone and mycin, others are used to treat the tremor, but also many of them cause cognitive problems, make people sleepy, and they cannot be effective at their jobs. Imagine if you're an airline pilot or a physician or somebody in the financial business district or whoever you cannot have cognitive slowing or being sleepy. So the medications can be effective, but they have significant side effects. So as a result, for 20 years plus, we've been doing brain surgery for this. But really, the ultrasound has changed the way we do things because we don't need to do brain surgery anymore that we've done for 25, 26 years now.
Wow. Dr. Desai, how often does someone have to be treated usually? Is this a one-time situation? Give us your view. That'd be awesome to hear.
I've been doing this for 8 years with the focused ultrasound, and I would say the patients, about 5 to 10% of them get the tremor recurrence, in my experience, and they have to come back for a tune-up in this case, so they can get retreated. But the vast majority of them only need the one treatment, and it's lasting, and it happens on the table. But in a small percentage, about 5 to 10%, they need to come back for a retreatment because the tremor can reoccur, but that's a small percentage.
Wow. Yeah, well, 90% effectiveness, there aren't many things like that. And then when they do come back, does it usually work when you do the secondary treatment?
Yes, there's not that many that have come back for a second time, but yes, indeed, when you treat the second time, you can fine-tune the ultrasound and get a similar results. And the beauty of this is that you can see on the table, on the MRI, you can observe the tremor stopping. So you have a immediate feedback with clinical or improvements in tremor and side effects. So you can look at them on the table and see the results. So it gives a lot of control to the treating team to optimize it for each patient by minimizing the side effects and maximizing the benefits live on the table.
That's extraordinary. Now, Dr. JJ Desai, tell me, we're going to introduce Alex Leventhal here. So I want to thank her for joining us. I understand you've gone through ultrasound in 2016. From my understanding, you've had it since you were 3 years old and didn't really know what it was till you were 40. And you suffered with it. So tell us, you've since become a successful CEO in the municipal bond business, but tell us, what was it like living with this? And tell us just a little bit about what the experience was like.
So everything that you were talking about in terms of the magic, even though it was August 22nd, 2016, I still remember that moment of being handed the Dixie cup at the end and just thinking, there's no way this is going to work, as I lifted that little cup up to my lips. So I'm a patient, by the way, originally at Weill Cornell, which was actually, I think, the first in New York City, but one of the first in the United States. Yes. After the FDA approval, but have been I like to consider myself an FOI, a friend of Insight Tech. So had it since I was 3. I had been given a medication, erythromycin, which everybody takes when I was 3, had a horrible reaction, 105 fever. And what the thought was that it may have been that high fever caused it to present. My dad had it, as these guys will tell you, can be familial. And so my whole life, from a young girl to a young woman to, being a working woman and parent, I have suffered with this annoying, frustrating affliction that causes people to think you're terribly sick, you have Parkinson's, you're excessively nervous. One woman even said, I just thought you were hungover all the time, which really seemed to me, I have a whole lot of thoughts there. And, to the point where if I went to a meeting or if I was giving a speech, I would not ask for water because I would be too panicked that my hands were going to shake. You tried
to hide it, it sounds like, from people.
I would do everything. I'd be like this. And, there's just a point where if you're going to move your hands or going to, write in a meeting, it was going to be evident. And I worked with my dad and my brother, and people would say, is she all right? And so it was really an affliction that just also grew over time. I tried the medications. I considered deep brain stimulation and just wasn't ready for that being that invasive. And I happened to see a story on Facebook one day. I was scrolling through, saw a story of the hospital in Israel where they first did it, and I watched with amazement. I immediately called my neurologist. He said, we're going to be getting it. And I said, well, sign me up. Didn't quite realize that where it was in terms of the FDA process. So once it was approved, interesting. I was going through a rather challenging time in my professional life, and I just decided, you know what? I have no control over anything else. I'm going to just do this and take control over this one thing that I have not been able to, to get over my whole life. And, didn't have a whole lot of time to really think about, being nervous or scared, and just was, as I said, that day, the most traumatic part was having my head shaved. But that day, my life changed. It was a little bit of a longer process, and I did have to stay overnight because it was still early, but my life changed in that moment. I still, again, being handed that tiny Dixie cup. And it's funny, and I'm sorry, I'm going on and on, but it still is just
you're passionate. How could you not be?
So I was 53 at the time, so I lived with him for 50 years, and now here it is 7 years later. I can't remember, it was JJ said that, people don't take things for granted. I never took things like lifting a bottle for granted because I couldn't do them. And I still don't take them for granted because I'm amazed that I can do what I couldn't do for 50 years.
My understanding is you're starting to develop a technology where you don't even have to shave the head. Is that true? Did I hear that correctly? Are you guys working on that as well?
Yeah, we have advanced technologies where we've been able to remove head shaving now from several of the procedures we do. And I think the beautiful part of these types of technologies is they just keep iterating and match the patient where they need to be matched in the future.
Fantastic. Well, yeah, listen, shave your head to have freedom for the rest of your life. It's be worthwhile. But I brought it up only because I know it's gotten better and better. And I was reading about or hearing about the fact that now in some cases you don't have to even shave the head. But tell me, what was your experience like back then? I hear the results. But going in, you said you didn't have time to be really scared. Tell us about going in, the process itself, and did the tremors go away immediately, and did they stay completely away? Give us your feedback.
So first of all, because it was still early in the process in the US, there were a bunch of folks who came over from Israel. So I felt like, I was the star of a photo shoot or TV show or something. And my husband was there, and Dr. Kaplan, the neurosurgeon, laughed. He said, I don't usually do brain surgery in a suit and tie. But, as I said, that head shaving was traumatic. I did donate my hair to cancer victims. So at least I, had felt like I was doing something positive. But that, and they do put this halo, which is screwed into your head. That's really the most traumatic. Then, you're there, they put you in you're in the machine. The first thing is you're given, and this is classic tremor diagnosis. You're given a piece of paper. You have to draw a spiral and a straight line. And if you have essential tremor, that straight line looks like a seismograph from an earthquake. I mean, you just cannot do it. And the circles are like that. So that's the base. They see, they have an example of how bad you are at it. They put you in the machine. It's funny you mentioned Star Trek, because I've always described it as, being in Star Trek, and it doesn't hurt, but you just do feel like, something strange is happening.
I was curious, did you feel anything, at all?
You know what? I actually equate it to, if you are pulling a plug out of the wall and by accident you touch the metal, but just a little kind of zap. But it didn't hurt. You do have this big sort of rubber thing attached to the halo that has ice water in it. So your head is really, really cold. But they put you in, they do the first, my medical term is they do the first round of zaps and bring you out. You draw the spiral and the straight line again. They see if it's improved. They put you back in. I had 7 of them. And on the 7th one, they rested. Now, on the 7th one, they said, you know what, this is this is as good as it's going to be, and it's great. And it was amazing, again, just seeing that line go from this to this and the spiral. And, just such joy, again, because it was still relatively new. And, my husband, who I'd been with since we were in college, who had actually worried about the ring dropping in the water when he proposed to me because it wasn't insured. He knew my answer. And then I remember spending the night in the hospital, and I would just periodically pour water in a cup and lift it up and down. And I would take videos of it because it was just so remarkable. Again, 50 years of not being able to do something as silly and basic as pouring water and holding a cup. So it was, was it scary? Yes, I mean, certainly. But I think I just had faith, especially going back to seeing that story on Facebook, knowing the Insight Take team, knowing how much I trusted the people at Weill Cornell. So it really was kind of the first day of the rest of my life kind of thing.
Alex, I'm so happy for you because you can feel your joy. And it's like, people take for granted so many simple things, our sight, our ability to hear, our ability to reach out and pick up something, and to see medical science create a breakthrough that after 50 years could give you that freedom. Just, oh my God, it gives me so much joy. And I didn't even do it. Dr. Masai, they do every single day. That's why they're such beautiful people. Well, thank you, Alex, for sharing. We really, really appreciate it. Thank you so much. It's truly extraordinary. Tell me where it's going now. I mean, what has the FDA approved so far? And tell me what you're seeing, what's happening next in this area.
Yeah, I mean, just, reflecting on Alex, being able to be around people with that kind of passion is sort of a privilege that we all, dream of. And so to be able to do that and get to work in that environment, I think just fuels myself and Dr. Rezai, I know. And one of somebody told me this one time, that the worst thing that anybody ever did was call essential tremor essential, because they make it seem like it's something so benign. And 40 million people in the world are afflicted with essential tremor. It happens just as much at 40 as it does at 70, and it's genetic. And to be able to provide that type of help is dramatic. So, in the future, we're just the best kept secret still. And so I think helping the essential tremor community, helping the Parkinson's community through expanded indications, more evidence in the real world that shows the durability of this effect, not only functionally, but economically. Medicine is expensive, and we want to get people back to living and back to being productive. And that's a self-fulfilling prophecy for all aspects of healthcare. And so we're really excited about that. The one brilliant part of this is taking energy into the brain. We know so many of the areas of the brain that cause some of these dysfunctions. And so we're not trying to invent an area to treat. We're trying to get to the areas we know have impact in a much more functional, outpatient, less invasive way. And we're going down that. And there's diseases that we're working in that are in the current R&D development with regards to clinical trials. They're not yet approved, but they've shown impact and benefit in things like epilepsy, neuropathic pain, and other areas where focality of treatment can be a big benefit to folks that are in between medication not helping them, but not wanting to go all the way downstream to a surgical solution, which may be really invasive, create implants, and have a sequence of follow-ups that can be really, detrimental to their lifestyle. But I would just impact in that setting, we're offering a spectrum of care. Disease and the way that people approach their life, it's not a one-stop shop. There needs to be different solutions for different people at different times in their life. And focused ultrasound and non-invasive therapies just widen that funnel to provide access to so many more people, to get them back without waiting 20 years to where they're ready to get something surgical. We want those 20 years to be given back to them, before they're taken away, and to have it done earlier. So that's the big one. And the second side of it is we've been working on a platform using the same look and feel of what, what Alex described, but rather than doing pinpoint accuracy, we're doing three-dimensional openings of the brain or applications of energy into the brain to look at our ability to impact global diseases in oncology and neurodegenerative, things like Parkinson's, Alzheimer's, ALS, glioblastoma, DIPG in kids, things that we've not moved the needle in 3-4 decades because of the difficulty of getting into the brain. And Dr. Rezai and the team at Rockefeller in West Virginia have just been on the cutting edge of getting this to patients in the clinic and translating some of the amazing research we've seen. And so we're excited to talk to you about that, Tony, and tell you a little bit about, the future of what this platform can do.
Me too. Tell me first, though, how many people have been treated? And am I correct in my memory that over 100 university hospitals or hospitals now make it available? And is it even covered by insurance in some places? Because my goal, obviously, is most of the greatest technologies you learn about. I read a study years ago. It's one of the reasons I wrote this book, is it's on average 18 years from the time you have the breakthrough till it gets to your clinician. And that's crazy. So I'm just trying to circumvent that as quickly as possible. So is this, how many universities or hospitals actually offer this at this stage? And in America, is there insurance coverage for some of it?
Yeah, so we have globally a footprint of about 150 institutions that have adopted what we call the commercial system treating around the world. And then about 50 institutions that are doing the research studies that we'll talk about in neurosciences and drug delivery and in neuromodulation. Globally, we have reimbursements. We wanted to get as many people treated as possible. And that really takes getting paid and allowing hospitals to do this and patients to do it without big out-of-pocket costs. So we have global reimbursements in Asia, Europe, the Middle East, and across the United States. And our goal is to constantly bring this closer to every patient around the world. So we're excited. We're 10 years into this journey. It typically takes 10 years for medical innovation to start to really make an impact in the marketplace. And at Insight Tech, we're really seeing that now.
Well, you guys are doing amazing work. Dr. Rezai, you're a neurosurgeon. You've seen everything down the pike. You're one of the best in the world. You're not only a great neurosurgeon, you're an amazing leader. I got to see what you've built there at the Rockefeller Center. What do you service now? About 220,000 patients a year, something of that nature. Is that right?
Yes, about 260,000 this year. It's a very large team managing people with the neurological and mental health conditions across large rural communities in the United States.
And tell us a little bit about your vision, because when you shared the vision and then more importantly, your execution there, when you came there, what was it you wanted to build before we get into some specifics, just to give people a sense of the amazing work that you're doing there?
Right. Our goal was to be able to provide the latest in technology and innovation for people in rural America so they can have access to the latest technology for tremor, for Alzheimer's, as anybody would have in New York City or in San Francisco, for example. So we brought different colleagues from across the world to create new technologies and helping people. And we have to get to people across rural America. They don't have to drive 4 or 5 hours to the large medical center here. We want to go to them using wearable technology and their telemedicine to help them. So that's really the genesis of the Institute, but also using our research platform with rapid cycle innovation to be able to tackle some of the big public health problems facing the country, whether it's Alzheimer's for an aging population or people that have problems with addiction that's ravaging various communities across the world. So that's really our goal, was to develop new technologies. And that's why ultrasound fits in perfectly, because it's non-invasive. It can be done very quickly. It's very precise, and it has tremendous applications, whether it's for brain tumors without much hope, and we can accelerate the delivery of chemotherapy into the brain by opening the blood-brain barrier, or Alzheimer's, opening the blood-brain barrier and clearing the brain plaques that are causing the Alzheimer's, or in the case of addiction, where we're going to have our patient David on in a few minutes, to be able to reduce the cravings and anxiety associated with addiction, with the hope of treating this big problem facing the country of addiction that affects 40 million people.
I have so much respect for what you've built there. It's built for people maybe who wouldn't go to San Francisco or New York, but you have people that come to see you from those places because of the quality of care you've done. So I don't want people to understate what it is you've built there. You guys are when I asked Dr. J.J. Desai, I said, where should I go see this? Because he goes, come and see what Dr. Rezai is doing in Rockefeller Center. You will be blown away. And I spent the whole day with you there, seeing all that you're applying. One of the things we did together that day, you talked about we were talking about the concern that we both have about what's happening with opioid addictions, all forms of addiction, of course. Most of us know that COVID just magnified it We had 100,000 deaths last year, 800,000 people that had non-fatal overdoses. So, 100,000 doesn't sound like much, but it's almost 1 million people. And our society is going through one of its most challenging times. And we've always had challenges with drugs, obviously heroin and things of that nature. But when you and I were talking, you were talking about how you were doing this initial research where you were doing, as you said, brain surgery, neurosurgery. You're going in and putting this stimulator in the brain and monitoring the brain waves to see how you could keep somebody from going through those addictions. And I met one of your patients, I think one of the 4 that you'd worked with, if I remember the FDA approved. I was blown away. Would you share a little about that before we share about what it's evolved to? Because I think it's important if people see how far it's come. Because when you were done, I was like, this is amazing. This man's whole life has changed, but you had to go through brain surgery and have a battery put in. I don't know many people are going to do that, how we're going to scale it. So we'll answer the scalability second, but tell us a little bit about, because it was groundbreaking what you did here.
Yeah, so we leveraged the brain implant technology we've been doing for 25 years with tremor or Parkinson's, and we wanted to place the pacemakers in a part of the brain that's involved in cravings and addiction. And this area is a key node in the brain called the nucleus accumbens. It's involved in cravings, anxiety, and reward that are associated with substance use or behavioral addiction. And so after a collaboration with the National Institute on Drug Abuse, we received a grant to start this with FDA approval in 4 patients as the first in the U.S. clinical trial, where we placed pacemakers in this part of the brain involved in addiction. And once the electrical stimulation started, the cravings were reduced and the drug use was reduced. And over time, we've been able to see abstinence in 1,300 days, for example, in the first person that you saw, whereas he used to get recurrence in use or relapse every other week before he came to us. And these are people who used to relapse and have, in fact, many overdoses. So they were really severe addiction patients that are really devastated and had overdoses. And this technology has helped really reduce their cravings and their drug intake. So based on that, we started saying, well, if we have to do brain surgery, why not do it non-invasively? And in this case, use focused ultrasound technology. But the brain implant study is still ongoing. We got approval from the National Institute of Drug Abuse recently to expand the clinical trial. So we're starting the next phase of the clinical trial. And the results have been excellent in basically curbing addiction and in fact, making some of our patients completely abstinent for 1,300 days or 2 years.
Dr. Rezai, the gentleman I met, the patient I met, he was a football star, if I remember correctly, and he got injured. And he was supposed to be, going off to college. He was like straight A, great student. And then next thing you know, they gave him opioids. He got addicted to opioids. And the next thing we know, he's now so addicted, he's going to heroin dens and he's trying to get opioids at all costs. And he described the absolute hell. And he said nothing would possibly stop it. But as I understand it, not only did it stop it for him since it's been now 2 years, which is extraordinary, but you learned about the brainwaves that you were showing me at the time, if I remember correctly, that you could see, I think it was 7 hours or 6 hours in advance before that addictive process would happen in the brain. You started to recognize, what did you recognize there that was allowing you to start managing things the most effectively?
We're able to see potential biomarkers, electrical signals in the brain. So the pacemaker is like a heart pacemaker. It can record abnormal heart rhythms, like an atrial fibrillation or a ventricular fibrillation. And so it's got a sensor that can detect that. And we're trying to see if we can come up with a biomarker that can detect cravings and anxiety and addiction behavior. So we're able to see initially with the early studies that there's electrical signal changes going on in the brain associated with increased cravings or increased drive to take drugs. So as we study this more, this can potentially be an important biomarker and electrical signature in the brain associated with addiction, but we need to do more studies and more research in this area. But we are optimistic about being able to develop a biomarker in the brain for addiction. And this is not just addiction from substance, it has to do with food addiction, binge eating, gambling. So it's the same part of the brain involved not only in substance use, but also behavioral addictions.
And Dr. Rezai, as I understood it, the way you did this at the time is put like a VR helmet on someone. So he was conscious while you're doing this, and you were asking them, you show them images and smells and everything else as if they're seeing heroin or whatever drug, cocaine they were associated to. And then that stimulation, you'd ask them what their level of a desire was, like on a 0 to 100, and figured out how you could bring it down by this stimulation. Is my memory correct? Is that how it worked?
You're exactly right, Tony. So what happens is that during the procedure, when we have the brain implant in the addiction center of the brain, we actually show our patients images that bring out their anxiety, or the ones that they're very sensitive to, whether it's heroin, cocaine, and others, to increase their cravings and anxiety. So we're sort of bringing it out, priming them to exposure. And then we want to be able to treat it so we can see if we can increase the anxiety and cravings and then bring it down. And that tells us that we're in the right spot in the brain to deliver electrical impulses that calm this area of the brain down, so the patients are not driven by this drive to seek the drugs and anxiety and just with a singular focus on going after this. And we're trying to shut down or decrease the cravings and decrease the anxiety and change the abnormal activity of this part of the brain. We're trying to alter the activity using electrical pacemakers, or in the new study we're doing with ultrasound.
So as he described it to me at the time, he said he literally, his addiction was so strong, he couldn't think of anything else. He didn't care about anything else. He had to do this. And now he walks by and he has no difficulty whatsoever. Seemed unbelievable. But as I said to you at the time, after you left the room, I said, you must be so happy. This is incredible. But the problem is, with millions of people addicted, how the heck do you scale this? And most would never go to brain surgery. Right. And you told me at the time, you said, Tony, we're investigating with ultrasound. Check with me in 6 months or 8 months. So that's part of why I reached back out to you here, obviously. Tell everyone, how does ultrasound, focused ultrasound, offer hope in dealing with addiction? And what's been these initial trials you've done? What kind of results have you seen?
Indeed, Tony, I think the goal was for us to see if we can reduce the, is David coming on? I can't see.
Yeah, he's on right now. I just saw him.
David Martin is our really true pioneer here. He's really a remarkable man with tremendous courage to be one of the first in the world to participate in the study. But basically,
David, it's a privilege to have you here. Thank you for joining us. We really appreciate it.
Thank you for having me.
Terrific. And in a moment, we'll get to David's story. But as far as some background, ultrasound helmets are used to deliver energy, as Dr. Desai was saying, to reduce the tremor activity with a pinpoint delivery. In our case, we wanted to move to an area that's not the tremor part of the brain, but it's the area involved with anxiety and cravings and the reward part of the brain, this area called the nucleus accumbens. And our goal was to deliver the ultrasound energy to this part like we deliver the electrical energy with the brain pacemaker, but without surgery, which ultrasound allows us to do. And then show, for example, our patients, and David will tell you, show images of what agents, what drugs they're sensitive to make that area more primed, and then deliver the energy to shut down that area or reduce the activity. So that was the goal behind it, to see if we can acutely, on the table in an MRI, to reduce the cravings associated with addiction. And the area where we're pinpointing is a different part of the brain. So that's really the genesis behind this. And as you know, Tony and others, the addiction is really impacting so many people. And we need to find solutions for the millions affected by this. And we need to explore all different technologies, whether it's a brain implant or, in this case, ultrasound will be a force multiplier for us, where we can really get, if it's proven over time, do a non-invasive approach for patients with addiction. And we're very impressed by the results that we're seeing so far in 8 participants for the study, David being one of them. We're expanding this further to get additional patients this summer with this procedure. So that's just a general background for the ultrasound.
Well, we have about 4.4% of the world's population, and we have 80% of the world's opioids. It's pretty crazy. A lot of people have no intention of even being in an environment of being addicted, and they become addicted as well. And then some people are in environments where obviously that's correlated to the way that people around them live. So to have a real possible solution. Now, when you and I met, and I think you said we just tried this. I think it'd been for 2 weeks at the time. And you said, Tony, I can't even believe it. I mean, so far for 2 weeks, we thought it might last a few hours, but for 2 weeks, they've not had any cravings, and you were going to get the additional funding to move to the 8 you're doing now. So Maybe we can pop in and talk directly with you, David. Tell us when you used drugs for 30 years, as I understand it, and started with alcohol and marijuana when you're just 10, but eventually got to heroin and meth. Tell us a little bit about your life and what you went through, and then what did you try previously, and then a little bit about how this process has worked for you so far.
Just a struggle. I mean, for 37 years, I struggled with my active addiction, and just recently, back in February, I was able to, fortunate enough to run into Dr. Zai in the care team here at the hospital, and they put me through the procedure, and it just the turnaround that my life is that they gave me. It's just it blows my mind, because I woke up every day. I had $150 a day habit, and I didn't have a job. I couldn't hold a job down because I was always chasing that drug. I was chasing that high, and I'd go out and bum money or steal money or whatever, however it took. I got a first-degree store-armed robbery charge on my record, because of my drug addiction. And it's just we're fighting a losing battle, and now this opportunity and the technology that they have here is just remarkable. It's amazing. I got 131 days clean today.
Congratulations.
Never in my life, if you'd have asked me this time that would you have 1 day clean, this time last year, I'd have laughed in your face.
Can you tell us, for someone who's not been addicted, how would you describe the level of focus or energy, or what the experience is of addiction versus what your experience is now?
Being a 5-year-old kid and waiting on Santa Claus, that's what the addiction is. That's what it's like. It's like I'm waiting for Santa to come down the chimney every single night, every single day, and I wake up. And no matter what, I'm going to get him down that chimney. I'm going to receive that present from him, no matter what it takes, no matter what I have to do, no matter who I have to hurt, and some people is taking it to the part to even take another's life. And that's just how strong and sad that this addiction is. The hold that it takes on your life, it just tears you down. And you don't have a care in the world. You can care less as long as you get that fix, that next high.
And what's it like now, by contrast?
Night and day. It blows my mind. It really does blow my mind to be able to sit here and say that I'm 131 days clean.
Does it feel like a struggle for you at all, or does it feel like natural for you now?
Now it's just like putting on my pants, it's crazy. It's like, this is it's almost like being in a car wreck and losing your long-term memory. I don't remember what it was like to be addicted no more. Wow. That lifestyle is obsolete to me.
David is really amazing. David, I mean, you've been taking alcohol and marijuana since you were very young person, right? You started at age 7, right? So this whole thing has really impacted you for so many years. And, for me, it was really amazing that you've been through every single drug, and you've tried so many different approaches. So maybe talk about that. And then I want to ask you a question about what you felt on the table when we delivered the ultrasound. So wanted to just for you to discuss that, please.
The day of the procedure, now I can't tell you exactly what cue that I received the procedure, but I do remember after they showed me cue cards, and they would that I was in the ultrasound machine, and I had the helmet on with the young lady was speaking of earlier, was very cold, the ice water on your head, and I had this what was it? The goggles on, and I could see the cue cards. They were showing me pictures of people shooting heroin up or smoking ice or whatever it may be. And I know after the third time that I seen the cue cards, my body like overheated. Now I couldn't tell you when the procedure was done, but I could tell that there was a change. There was something that was a change from that point on. I don't know when it happened. I just know that there was something happened to make my body overheat. And I guess it was just my endorphins just exploding and it having an effect that I haven't had in years. And they say that to be a drug addict, like once that highway in your brain is built from using drugs, it's always going to be there, you know? And that's why it's so easy for us addicts to just stop using for 6 or 7 months and then pick it right back up again, because them roads are always there. Them pathways are always there. And now with this procedure, it's just like I'm sitting on my car sitting on blocks. I don't have no wheels. I can't go nowhere.
That's awesome.
David, talk about it. What we're seeing is like a disconnection of the between the images and the cues, if you will, what really typically brings on your cravings to use drugs. And so we've seen a disconnection, if you will. The brain has changed with a light switch. Can you explain that more, David, in terms of what you felt? Because it was surprising for us to see this.
Yeah, and I would have loved to have been able to see just a picture of the video of my brain at that point in time, because beforehand, like I'd see a cue card with the name tag, and you got your strip with your name tag. It's like this. I got it, my narcotic. This is my day sober key tag, and but we're just basically to have this rope and a card, and when I would see that card, my mind would automatically, I would think of, I'm cutting up some coke, or I'm getting ready to do this, or get ready to do a line or something like that. And then after I had the procedure, I seen the same cue cards, and my mind didn't say use it for drugs. It was like I felt bad. I felt ashamed for the person that thought that way before, you know, the person that I was, and just the immaculate change that it brought to me is just, there's no words that can explain really how I feel. I'm just so grateful to have been able to give this opportunity. Right before anything happened, I never did any good grades in school. I was always messing up with school, chasing drugs and everything else, you know, and couldn't sit down and do work long enough to do anything. And now I'm back in school again. I'm back in college again. I'm going to get my basics in criminal justice so I can become a therapist in the drug and in the drug community. You know, I want to give back. I want to help.
That's beautiful, David.
My brothers and sisters that's still struggling with this addiction, because I'll be an addict till the day that I die. That's a mark that this is a disease. Yeah. This is like it's a disease, and I have to treat it like a person that's a diabetic. You got to treat it the same way. You can't be a diabetic and drink alcohol or eat a bunch of sugar, or you have to change your lifestyle. You have to change the things that you do and the people that you hang with. But I could go around. I've helped people, and I used to use drugs with needles, and I've just recently helped people shoot up, and still didn't have that urge or that desire to get back up myself. Wow. And it's thanks to these people, the Dr. Rosine, them, it's just amazing. It's crazy.
I hear you're doing really well in school too. This is amazing. Yeah. This is beautiful. Yeah. But I heard your grades are really great. Is that true?
Yes, I'm making A's. I ain't never made an A before in my life. I had A's. That was all the A's I ever had in my life. After. And that was the only A I ever made on my report card.
David, you were talking about like, what you felt, and, you were talking about your mom and how, you wanted her to see you doing this. And I think it's really important what's happened afterwards. You were talking about help somebody shoot up because they were going through withdrawal. You were trying to help them, right? And so this is really, you left from the procedure, you went back into your environment, into being around people that usually would provoke you to take drugs, right? So I think that's it. Behaviorally explain what's happened to you since this.
It's like night and day. It's like a night switch or a light switch. Oh man, it's so hard to explain it to somebody that doesn't have the desire to want to use. It's hard to explain to somebody that's never picked up a drug or a habit, anything. It could be gambling, sex. There's so many different diseases or addictions, and to sit there and try to explain it to somebody that has never been in that driver's seat, it is hard to do. It's very hard to do.
One of your patients, Dr. Razai, said to me, it was like, imagine you were starving and hadn't had food for 7 days, and you've got to get some food to survive, but that's happening every moment of your day throughout the day, except when you're high.
Right. So, it's like that goldfish, the goldfish thinks that they're hungry every 10 seconds or so, or whatever their life. And that's how it is. That's what it is. No matter, I could turn around and shoot up and get high, but then 15 minutes, 20 minutes later, I need it again. I need it again. I need it again. And it's just constantly chasing, and destroying just relationships, your loved ones, your family, and the people that you shit on and that you tear down because you just because I'm struggling with my addiction, they're going through the same thing. That's like seeing somebody that's locked up in prison. Just because my wife is incarcerated, I'm incarcerated with her. I'm going through the same thing. I might not be behind them bars, but I'm still going through struggles the same as she is. And that's how the life of addiction as an addict is.
Dr. Razai, I noticed something David said, and you said something interesting. He said, the guy I was. And, my experience in shifting humans' behavior and emotion is always the only way you get a long-term change is an identity change. Whatever we identify as who we are, that's what we become. That's how we live. That's what we experience. And this process has caused him to separate who he was to who he is at his core. Is that something you're seeing in more than one patient? Or I'm just curious. It's pretty extraordinary.
Yeah, I think this is we have to further validate and do more patients, but we're quite impressed. Our team, Doctors Mahoney and everybody else, we're very impressed by what we're seeing for people like David and others who've struggled with addiction of different substances for so long, that the effects are really amazing in terms of reducing the cravings and then changing the behavior. Like David was saying, it seems like a light switch or a dimmer switch for cravings and drug use. And then that allows the therapist and the peer recovery counselors to work better with the patients impacted by addiction, because it's not a miracle cure, but it sort of changes the brain. So now imagine a brain for 30 years has changed with addiction. We reset the brain, if you will, and delete that addiction program for the brain. Now the individuals need to engage with their therapist, peer recovery coaches to regain a new way of living their lives that has been taken away by addiction. And that's critical. So it needs to be done in ultrasound or deep brain stimulation in combination with behavioral therapy to be most effective. And we need to re-engage and relearn all the aspects that these individuals have not lived with, because addiction has been dominant in their lives and has been the central focus. But you delete that program from the brain, now they're able to say, okay, here's my life, my opportunity in front of me without addiction. And that's what David is doing in terms of going back to school. He's really a remarkable man. I mean, I cannot believe for 35 years, since you were 7 years old, you've been taking drugs, and it's literally amazing. And your story is just remarkable. You're really a pioneer in this, and with tremendous courage for you to be one of the few. It's the first study in the world. It's never been done before. And it's a very large team of many individuals, Doctors Mahoney, the other specialists that are there with us. So it's very complicated, but we're quite pleased at what we're seeing so far in terms of reducing addiction cravings immediately on the table with ultrasound and changing the brain function right away.
Well, David, used the example of, I use the metaphor often with people. Most people have a highway to frustration or anger or sadness, and they got a dirt road to happiness. But it sounds like that road that used to take you down the drug road is gone, and now you're building new roads to a new life in such a gorgeous way. And even more so that you want to help others to do it. I just think, David, you're such a beautiful man, and you're going to inspire so many people with this broadcast. I'm so grateful you sharing your story. What would you say to someone who thinks there's no hope?
Don't never give up on yourself. Never give up on yourself. That's why do you see them 2 chairs in the center of the floor in the NA meeting? Those seats are for the people that didn't make it. If you're sitting there looking at them chairs, you got a chance. You made it. Don't ever give up on yourself. You know what I'm saying? When they put the tulips on your grave, that's when you stop fighting. But if you got a breath in your lungs, then you got a chance to fight. You got a chance to live and live your life. And they've given me the opportunity to live the life. I never knew what I wanted to be. I never thought. I always say, excuse my language, why the hell am I on this earth? What am I here for? I'm ruling in myself. I'm killing myself. And everybody that I was associated with, I never had a friend. I'm 44 years old and have not one single friend that I could actually sit there and say that's my friend. Because everybody that I've ever been with was only associated with for something that I could give them, they could get from me, or they was just they was giving me something that was killing me. They wasn't trying to look out for me or help me or anything. And my first day when I came to partake in this procedure, I got out of the security car out here in front of the institution, and I seen one of my old street fellow people that I used to hang with, the homeless crowd, and he's like, yeah. I said, I'm at Hope and Healing. Well, I'm meeting my buddy. He's coming around, and his dealer showed up and had a nice second. He still offered it. He was going to give me something for free, knowing that I just told him that I just went through 7 days of hell and detox, laying in the shower up there, open healing until 2-3 o'clock in the morning with the water running on me. I'm laying on the floor, shaking like a newborn, just going through detox, just trying to get this drug out of my system. And then he just wants to give you something for free. But when I was out here on the streets and didn't have anything and was sick and was needing it, he wasn't giving it to me then. The devil never takes a day off. Devil never takes a day off. Wow.
Well, you're a miracle and you're a courageous man, and we really have so much respect for you and love for you. And I know you're going to touch so many lives because, you can't touch other people unless you've been touched, right? You can't move other people unless you've been moved. And you've lived this, brother. So excited about your new career and direction. And I want to, if you have an interest, I'll get with you afterwards. I'm going to invite you to come to one of our events because we train therapists all around the world and some very advanced techniques. Dr. JJ Desai knows about it. The speed of results are amazing that could add to your skill set. So if you want to add to that, I'll give you a scholarship for it. You can be part of that program. So I'll follow up with you on it. But I just want to thank you. I think you're going to excite a lot of people about what's possible. Millions of people are suffering from this, and people don't understand it. And you see people make judgments about people's behaviors, and what you realize is the brain is just not functioning properly, because here's a man whose brain's functioning properly, and his true soul has come through. You're beautiful. So thank you for joining us, and thank you for sharing your story.
Thank you. We're glad to be here. Glad to be a part of it.
All right. Blessings to you.
Thank you.
Wow, that's breathtaking. All that with one session. Was it one session of ultrasound that he did? Focused ultrasound?
Yes, it was one session. And David can tell you, yes, it was about 15 minutes of treatment. So that's why we have to replicate this and do more studies. And we need more resources. We need more collaborations with the government, industry, the NIH, so we can accelerate the pace of this research. Really important. But David is remarkable, and it's just his story is unbelievable that in terms of what's happened to him. And the same thing with Jared, the other patient you met with the brain implant. They've both become counselors, other patients. So they want to give back because they have lived this day in and day out, and they want to give back to the community. And so they have the best insight into helping others. But Tony, you're right. It needs to have additional support. You need to combine this technology with behavioral therapy. Then you'll get the maximum benefit for people.
That makes total sense. Tell me what kind of response are you getting from the medical community here? Are they excited? Are they pushing back? Are they skeptical? It seems too good to be true that you could treat somebody for 15 minutes when nothing else has worked for 40 years or 30 years, and have them have this kind of transformation. It's miraculous. What kind of response are you getting in the medical field from medical establishment, pharmaceutical companies, and surgeons?
Yeah, you're correct. People are, as we're trying to get more and more data, because then we're going to present it at national meetings and publish it in major journals. But some of the feedback initially from people they've talked to, they're like too good to be true, and we agree. So we want to prove it to people by now starting a new study. There's a sham study where some patients get the treatment, some don't, and then they go outside and see how much they relapse or be readmitted. So we have to prove that, and we have to prove the mechanism behind this. But the results are very consistent so far. We're very cautiously optimistic. It's medical research where we're quite surprised what we're seeing. Sounds like we are resetting the brain. Imagine it's like cardioverting the heart from an abnormal rhythm into a new rhythm. We think that we're also changing the abnormal rhythm acutely with ultrasound in the part of the brain that's involved in addiction. But we have to prove that with further patients. 8 patients so far, very good results. And you're right, some people said, we don't believe it. And that's fine. We have to prove it to people by showing long-term not using, doing urine talks, random urine talks that shows that no drugs are in the system, and looking at brain scans that shows the brain is changed. And that's what we're doing right now. So we need to accelerate this research for addiction because it's quite impressive. The next area we want to look at is post-traumatic stress disorder and other conditions, because we also think this may be a benefit in people impacted by PTSD.
That would make total sense. What is the timing on the next study? What are you looking for? And what do you need? Or, for people out there, if there's people out there that could help move the needle for you, what are you looking for to accelerate this process?
So we're looking at additional 15 patients this summer, people with alcohol. Methamphetamine is a big problem, which with no medications. For opioids, you can treat with Suboxone, for example, but there's no medication for the crisis with methamphetamine out there. So we're looking to add additional patients and study them. What will really help us is funding. We need funding from the government. If there's donors and others want to support this, it will make a big impact for us to rapidly accelerate and then put this at other sites. It cannot be done only here at the Rockefeller Neuroscience Institute. We need to make it be done at multiple institutions across the country. But we're trying to fine-tune the technology and the technique of where to deliver the ultrasound beam, how to deliver it, when to deliver it, and what doses to deliver in collaboration with our colleagues at Insightec.
And what's the budget on the next study, for example, so if people wanted to contribute, they can understand?
Yeah, the next study, for example, for 15 patients, it cost us $1 million to look at 15 patients to do it. And that requires so many scans. This is a really detailed study that we have to do, looking at many, many variables and long-term follow-up. So it does cost money, and we're looking at partnering with National Institute of Drug Abuse. In fact, Dr. Nora Volka recently had a blog. She's the head of the National Institute of Drug Abuse, and in her blog recently, she said she sees a big future for the ultrasound as a game changer as well, in terms of having a great opportunity for helping patients. And she really believes in these neuromodulation technologies. So it's quite exciting, but Tony and JJ, we have to validate this further. And David is a validation, but we need more. We need to do a sham controlled study where, let's say David will be in the scanner and we don't give the ultrasound and then we give it to another person and we see how they are outside. If they're using drugs, how their cravings, that's really one of the next steps.
Comparing the placebo to the actual treatment, I understand. It seems like such a small amount of money for such a giant project in terms of impact. You think of the trillions of dollars we spend on things that don't make any sense. The fact you don't have $1 million yet for this makes me crazy. I'm going to give you 10% of that myself right now. I hope some of my viewers may decide to do that. So I'll provide $100,000, the first 10% moving forward. And hopefully some other people watching maybe decide to join me in that process. We'll arrange that with you, Dr. Rezai, for sure. Tell me, just to wrap this all up, which has been so inspiring, guys. I can't thank you enough for taking the time. More importantly, I can't thank you enough for the work that you're both doing. From both your perspectives, where do you see this technology going over the next 5 to 10 years? So maybe come back to you on that, Dr. JJ. Decide.
Thanks, Tony. I just want to reflect. We've heard from Alex and from David, and I think David's closing sentiment of never give up was just so powerful and resonating. And they're the heroes here, them and their loved ones who took the step forward to change their lives. And never give up is something that we tell ourselves every day. Our technology team, our clinical team, we're jumping hurdles to try to bring this to patients. The brilliant physicians like Dr. Rezai we get to work with, members of the community and advocates like yourself. This is a story that has to be told a million different ways and as much as possible so people know what's out there for them. So the future of this technology is very bright. I think the beauty of it is that it's a platform. It's simple and intuitive. And as Dr. Rezai inflected, we only speak in evidence. So we speak objectively, we speak through proof. We love our patients and we love the anecdotal stories. They're impassioned and they're so emotional. It's really what triggers you. But at the end of the day, we have to stand toe to toe with peer-reviewed evidence. And that's what we've done from day one as a company at Insight Tech. And we will continue to invest and do that. And the future is very bright. When we combine the movement disorders, we now can treat both sides of the brain. It unlocks an entirely new realm of therapy for folks with essential tremor and Parkinson's. And the evidence of us being in phase 3 trials and expecting approvals of delivering the next generation of molecules into the brain for oncology, neurodegenerative, Alzheimer's, and the ability to deliver energy for things like addiction and PTSD. This is a frontier that we're passionate about, and we'll fight relentlessly to make sure that everybody who needs it out there will get access to it.
Dr. Rezai, what's your view of the next 5 or 10 years of this technology?
I mean, I've been doing brain surgery implants for 26 years. I think this is a transformative technology because it's non-invasive. Patients are treated and they get off the table and go home. And I think the potential is amazing because it's non-invasive. And also a bigger application that we haven't discussed is opening of the blood-brain barrier that allows us to deliver new therapeutics, drugs, antibodies, medications that we could not do before because the blood-brain barrier prevents 99% of the therapeutics from getting into the brain. That's why you need to take a lot of doses, a long time. If we can open the blood-brain barrier and deliver the therapy to the area where it needs for Alzheimer's like we're doing, that can be very important for the future of accelerating pharmacological treatments into the brain. So whether it's neuromodulation for addiction or PTSD or chronic pain, or doing high-intensity focused ultrasound for tremor or Parkinson's, or deliver drugs into the brain, this is a very unique time with this technology. So we're excited, but we need to do more research, accelerate the research, and we really appreciate you highlighting this to get it out to the world. That's very important that people understand these technologies are here, and we need to move faster. Like you're saying, we can't wait 18 years. It needs to be done in 18 months.
Yes.
Got to move very quickly in this.
The need is now for sure. Well, I want to thank you both for joining me again. Thank you once again for all that you're doing for people, your beautiful souls, and the impact you're having is extraordinary. If people want to know more about you, they can pick up Life Force. There's an entire chapter here. But if they want to talk to you directly, what's the best way to reach out to either of you?
They can get into contact the Rockefeller Neuroscience Institute at West Virginia University. So we'll be happy to connect and provide thoughts and help you in any way we can. So thank you very much. And
JJ for Insight Tech?
At insighttech.com, and me specifically, it's very easy. It's JJ at insighttech.com. And we're always happy to provide information and connect people where we can be most helpful.
That's wonderful. Well, gentlemen, this is a beginning of a journey, not the end. So thank you for letting me join you for part of it. And Dr. Rezai, I'll hook up with you to follow up on what we discussed here to help get this ball moving forward on the next study. Thank you very much for that.
You're amazing, Tony. Thank you very much. That's extremely generous. That will really accelerate, because this has all been enabled through donors, because we have to get the data, then apply for NIH grants and all that. But this has really been to the generosity of donors that has helped us to do this. Also, Tony, I was going to ask you, last time I saw you, you were on your way to Boston for the game with the Warriors. That was last year. Tonight's another big game. So it's just funny. Whenever we talk
yes, I know. I can't be at the game tonight, but I did go to the game. I got another ring, and I've been coaching the team. I own a piece of the team. So I'm praying for a great performance tonight. We've had some ups and downs, boys, some big wins and some big losses. We'll see. We got a tough opponent, to say the least. But great seeing you both. Blessings to you both. And we'll connect with you soon.
Thank you. Take care.
Thank you so much, Tony.
Bye.